What is PPE? PPE is personal protective equipment worn to minimize exposure to hazards in the workplace. Not only is it used in healthcare, but also in other industry jobs, such as construction or mechanics. When we talk about PPE shortages in healthcare, we're talking about the CDC recommended use of N95 or higher respirators, face shields or goggles, clean, non-sterile gloves, and an isolation gown. Particularly, the conversation around shortages is focused on the N95 respirators. If an N95 or higher respirator is unavailable, a face mask is an acceptable alternative. Unfortunately, we're also seeing a shortage of face masks as well. Why is the N95 the best choice? Amongst face masks, there's a wide variety of how protective each mask can be. If worn correctly, face and surgical masks can protect against large respiratory particles. They are also important in preventing one's own saliva and secretions from being spread to others. This is why you hear about patients wearing face masks if available. There's a recommendation to wear a face mask out in public if social distancing is difficult, such as at the grocery store. On the other hand, N95 respirators are custom fit to one's face and form a very tight barrier. The N95 in the name means that the mask prevents at least 95% of very small particles, 0.3 microns, from passing through. These are more effective and recommended for healthcare workers only. Both face masks and N95 respirators are designed to not be reused. This is leading to the shortage of supply we are seeing with increased patient volumes and need for PPE.
How are regulatory agencies responding? The United States Department of Health, Occupational Safety and Health Administration, OSHA, and Centers for Disease Control and Prevention, CDC, set the standards for PPE in the United States. OSHA has extended flexibility in its standards to allow for alternative procedures to reduce risk of provider exposure in light of the shortages. The CDC has offered suggested guidelines for facilities to respond to the shortage. Though the recommendation is for N95 respirators to be used, face masks are an acceptable alternative when shortage presents. The CDC advises that homemade masks, such as bandanas and scarves, only be used when no face masks are available and in conjunction with a full face shield. Isolation gowns, which are non-sterile, are preferred to surgical gowns to preserve the surgical gowns for sterile procedures. However, in a shortage of isolation gowns, the surgical gowns may be used for treatment of patients with COVID-19. Coveralls may also be used. The CDC also offers recommendations for extended wear and reuse of PPE when shortages are severe. Facilities are to resume standard practice when PPE becomes available. What can you do to help? Across the country, PPE drives are being run to collect donations for OSHA. Links to some of these are included on this slides. Donations of regulation-grade PPE and homemade masks are accepted. There's a link to a tutorial provided here as well.